Philippine Nurses Licensure Examination. Nursing practice for care of clients with physiologic and psychosocial alterations. Part 2. Master your nursing practice for. Let's start. Question number 1. A client with a new colostomy is concerned about odor control. Which of the following foods should the nurse advise the client to avoid to help reduce odor? Letter A, apples. B, yogurt. C, broccoli. D, rice. Answer: C, broccoli. Explanation: broccoli and other cruciferous vegetables produce gas and odor, which may increase discomfort for colostomy clients. Question number 2. A client recovering from an ileostomy placement expresses concerns about leakage. Which of the following recommendations should the nurse provide? Letter A, change the appliance only when leakage occurs. B, avoid high-fiber foods to prevent obstruction. C, empty the pouch when it is half full. D, change the appliance once a week. Answer: C, empty the pouch when it is half full. Explanation: emptying the pouch when it is half full reduces the risk of leakage due to weight and volume. Question number 3. A client with an acute kidney injury is in the diuretic phase. Which electrolyte imbalance is most likely to develop during this phase? Letter A, hyperkalemia. B, hyponatremia. C, hypermagnesemia. D, hypercalcemia. Answer: B, hyponatremia. Explanation: the diuretic phase of AKI leads to excessive fluid loss, increasing the risk of hyponatremia as sodium is lost along with water. Question number 4. When assessing a burn victim, which finding indicates a need for immediate intervention? Letter A, blister formation on burned skin. B, ashen, grayish skin tone. C, pain and redness at the burn site. D, firm, leathery skin over the burn. Answer: B, ashen, grayish skin tone. Explanation: an ashen grayish skin tone could indicate a lack of oxygen and severe respiratory compromise. Question number 5. A patient in the post-acute phase of a burn injury is experiencing severe itching at the burn site. Which intervention would the nurse suggest to manage this symptom? Letter A, applying cool compresses. B, using scented lotion. C, wearing tight clothing. D, rubbing the area firmly. Answer: letter A, applying cool compresses. Explanation: cool compresses can help reduce itching and healing burn areas, as they soothe the skin without irritating the burn. Question number 6. A client with a traumatic brain injury presents with decreased response to verbal stimuli. Which position should the nurse avoid to prevent increasing intracranial pressure? Letter A, elevating the head of the bed to 30 degrees. B, keeping the neck in a neutral position. C, turning the client to the side. D, placing the client in Trendelenburg position. Answer: D, placing the client in Trendelenburg position. Explanation: Trendelenburg position increases ICP and should be avoided in patients with traumatic brain injuries. Question number 7. Which electrolyte imbalance should the nurse monitor for in a client with acute pancreatitis? Letter A, hypercalcemia. B, hypocalcemia. C, hyperkalemia. D, hypernatremia. Answer: B, hypocalcemia. Explanation: Acute pancreatitis often causes hypocalcemia due to fat necrosis, which binds calcium in the tissues. Question number 8. A client who recently underwent a total hip replacement is at risk for a pulmonary embolism. Which symptom would require immediate action? Letter A. Low-grade fever. B. Swelling at the surgical site. C. Sudden shortness of breath. D. Decreased appetite. Answer. C. Sudden shortness of breath. Explanation. Sudden shortness of breath may indicate a pulmonary embolism, a potentially life-threatening complication after surgery. Question number 9. In a client with hyperthyroidism, which symptom would most indicate a thyroid storm? Letter A. Sudden increase in body temperature. B. Mild headache. C. Slow pulse rate. D. Slight tremor. Answer. Letter A. Sudden increase in body temperature. Explanation. A thyroid storm is a severe, life-threatening complication of hyperthyroidism, often marked by sudden high fever, tachycardia, and altered mental status. Question number 10. A client with chronic kidney disease, CKD, has a potassium level of 6.2 milliequivalents per liter. Which food should the nurse advise the client to limit? Letter A. Apples. B. Potatoes. C. Rice. D. Bread. Answer. B. Potatoes. Explanation. Potatoes are high in potassium, and clients with CKD need to limit potassium intake to avoid hyperkalemia.